So, good evening. And this is the third session. In third session, we covered what is meant by US healthcare, components of US healthcare. Also, we saw what kind of insurance plans are there in the market. Okay, and then specialities for the doctors. Then we covered how the claim is going to the insurance, and for physician billing, there is a CMS 1500 claim form and the hospital billing UB04 claim form. These are the important points you have to remember. Then we covered how the claim is going to the insurance. So most preferred way is the electronically, and there is a mediator application EDI. Everybody is using in between practice management software and the insurance company. Okay, and to check all these rules on the claim form, that process is called as scrubbing process in EDI software. Okay, then we saw the ways how to submit the claim form, ways how we are receiving the payment from the insurance companies, and what is meant by EOB, EOP, and ERA. Okay, it is nothing but the receipt, and then pros and cons. So this was the first session. In second session, we saw AR responsibilities with RTM cycle. Then we covered in yesterday's session we covered RCM cycle. Okay, so now this is the third session today, and let's see. So today's session is dedicated or specially for the claim form. It is very important to understand about the claim form. There are some important boxes on the claim form, and in any client, for any client in any state in the US for physician billing, claim form will be same. Okay, so all over US, these two claim forms are used by provider, and every insurance company have to accept these claim forms. Okay, and whenever we are joining in any company as a fresher or maybe experience, so I know that everywhere the application will be different, but the functionality will be same. But initially for 1 week, 2 week, or maybe 1 month, we are not that much familiar to navigate fastly in the application while on the call. So best way is just open the claim form, and all the important information is available on the single page. Okay. So this is the CMS 1500 form used for the physician billing. We are going to focus on physician billing. Okay. There is a one more claim form, that is sample UB04 claim form. It is for hospital billing, but we don't have to worry about that. Okay, because even though we are focusing on the physician billing, and if any company is having opening for hospital billing, then also they will consider your profile. Okay, so this UB04 is having almost 81 boxes. Okay, but at this point we are not focusing on this claim form. Okay, for hospital billing, so we'll focus on the CMS 1500 form. It look like this in any application. It is not in the black and white color. Always it is in this color only. Okay, and every single claim form is the unique claim form. We cannot use this claim form for multiple patient or maybe multiple date of services for the same patient, because there is a barcode. Left side you can see there is a barcode. That means each and every single claim form is the unique claim form. Okay, and it is not free of cost. If you are talking about the electronic claim form, almost $4 to $5 are charges for each and every claim. And if we are talking about the hard copy, that means paper claim form, which is present in the printer, and whenever you are giving from your application, whenever you are giving the action for billing the claim, it will ask us how we have to build our claim, electronically or paper. If you are selecting the electronically, then electronic payer ID should be correct, and then it will go through the EDI. But if you are selecting the paper, then blank claim forms are present in the printer in hospital itself. It will get printed, and someone is there who is responsible to send that through courier company to that insurance. Okay. So from this claim form as well, if you go through the frequently asked question 5, okay, in many interviews they will ask you some random questions or random boxes from this claim form. So there are total 33 boxes. Okay, and this is the easiest question. We should not miss this question in any interview. Okay, you can see here box number 23. They ask box number 23 here. You can see here box number 17, 21, 29. Like this, most of the interviewer will ask you some important boxes from the claim form. Okay, so this is the easiest question, and we should not miss this question. Okay, hardly they will ask you 4 or 5 questions, and this is one of the interview question. Okay, so don't worry, you don't have to remember all 33 boxes. Okay, I'll give you 12 to 13 important boxes, and that you have to remember. Okay, so let's see. So here we have three portion on this claim form. Left side you can see carrier, then patient and insured information, and then we have physician or supplier information. Okay. So what is meant by carrier? So carrier is nothing but the insurance. I have one more note, that is the additional note. So I'll mention these points in a second. Okay. So first time we are hearing this word as a carrier, right? Carrier, right? One second, let me check. Carrier. Carrier. Carrier means nothing but the insurance, also called as payer. Okay, so this is the common name for insurance. Okay, somewhere we will see the carrier or payer. It is nothing but the insurance. Okay, same like now. Second portion is for the patient and insured information. Okay, so insured means policy holder. Insured means policy holder, means who has taken a policy, or subscriber, that means subscriber of the policy. Okay. Now third portion is for the physician or supplier information. Okay, provider, supplier, physician, any person or facility which is providing health services are called as provider. Okay, so these are the three portions, and it is having total 33 boxes. If someone is asking you how many boxes are there in the CMS 1500 form, so remember 33 boxes are there. Okay, the first portion is for the carrier. That means whenever we are billing our claim to any insurance, insurance information is going. So example Aetna is the insurance name, and then Chicago, Chicago, Illinois. Okay. So like this address will go here for the insurance. Okay. That's it. Whenever we are opening the claim form and validating, like if the claim is already billed to the insurance, okay, we can see here history. Okay, claim was billed to the insurance. And whenever we are checking on the insurance web portal for this claim, if claim is not on the file, and if you are you can see that if it was billed through electronically, then we'll check in the EDI. If it was billed through paper, then we'll check uh, directly with the insurance representative or the website. If claim is not on file on the website, then we'll check with the insurance representative. Okay, and we'll confirm the claim mailing address, and then we'll open the claim form, and here we will see what address we used to file that claim form. Okay. So let's see some important boxes. So second portion is for the patient and insured information. So right side of the portion here is for the insured information, that means the subscriber information, and left side is for the patient information. So it is not mandatory that every time the policy holder is only the patient. Might be possible that the policy holder is not the patient, but his family members who are added in the policy as a beneficiary, maybe mother, father, wife, children's sister, brother, whoever has added under the policy as a beneficiary can be a patient. Okay, so left side we'll see box number one is having some insurance names. So as I said, this is the uh, designed by US government department. So this is approved by National Uniform Claim Committee. Okay. So box number one is having some insurance names, and these insurance names are government insurances. Everybody is not getting this insurance. Okay. Medicare, Medicaid, TRICARE, Champa. Group health plans, FECA black lungs, all these are the government insurances. And to get this insurance, there are some eligibility criteria. We'll see that in our upcoming sessions. And there is a other box, that means if any insurance policy patient is having and the name is not there, then it will go as a other. Okay. Box number two is having patient name. Now in US, name format you have to remember. It is not like India. Okay. Name format is last name, first name, and then middle name initial. Okay. So this is the format in the US. Everywhere they are following this. Examples: April, Tom, or Bill, and then K. So here April is the last name, Bill is the first name, and K is the middle name initial. In India, we are using first name, middle name, last name. But here format is last name, first name, and then middle name initial. So everywhere, don't worry, you don't have to change anything in sequence. How it is looking on the claim form as it is, you have to read, or maybe you can see in the application. Okay, in the application also how the name is displaying as it is. You have to use here. David is the last name, Johnson is the first name. Okay, like this. Uh, ID card also, if you are checking the insurance ID card, there also they are using the same format. Okay. Here in box number two, patient name is going. Box number three is the date of birth and the gender. So date of birth, date format also you have to remember date format in US. Okay. It is mm DD YYYY. Okay. Example, if I am writing like this, so this is not the 5th July 2025. This is the May 7th, 2025. Okay. If you are wrongly telling them the date as a 5th July 2025, then they will say as a claim not on file. Okay. So it is very important that we should give them the correct format, correct date. Okay. So this is the carrier, this is the insured, this is the provider. Okay. And this is the date format. These are small points, but these are important points. Okay. Nobody will tell you in this much detail anywhere. Now, next is the box number 5 is for the patient address. So, detail address is there. Okay. Patient address like the street, city, zip code, state. These details are going in the box number 5. Box number 6 is for the relationship to the insured. That means the policyholder. So, maybe the policyholder itself is the patient. Maybe the policyholder is the husband and the patient is the wife, or vice versa. That means the policyholder is wife and patient is husband. In both the cases, spouse will be used. Third is for the children, and if any other relation like mother, father, or sister, brother, then we can use as a other. Okay. Box number 8 is reserved for NUCC, so we are not using this box. So we are not using that box. So whenever you are seeing reserve for NUCC, that means National Uniform Claim Committee. So we should skip that. But don't worry, I'll tell you the important boxes at last, which you have to remember. So box number 9 is for other insured name. So at this point, just keep this box. I never use that. And you can see most of the A, B, C, D are reserved for the NUCC only. Box number 10 is for the is patient condition related to. That means due to what reason patient came to our hospital. Is it related to the employment injury or illness? Yes or no. Is it related to the car bike accident? Yes or no. Okay, anything. Is it related to any other accident? Okay, like this. The data will go on this claim form from the application itself. Nobody is filling any data manually on this claim form. That remember. Okay. We are not doing any changes manually on the claim form. If any policy ID or anything is missing, like wrong, if patient name is wrong, okay, with so here on the claim form, name is wrong, but we are not manually changing that. Okay, we are not manually changing that. We will change into the application and then we'll rebuild the claim and then correct information will go on the claim form. Okay. So box number 10 is for patient health condition related to. Okay. Now box number 12 is for you can see this is the patient or authorized person signature. So as I said, this claim form we cannot use any pen here even though the paper claim forms are there in the printer. Nobody should use any pen to write or to do some changes or tick anything. Okay. That claim form will not be acceptable. So here the signature will go as a digital signature. Okay, whatever it is, it will go a digital signature, not the manual signature. And when it was signed, okay. So example today's date, okay, Jan 14, 2026. So these are the boxes for the patient's health information, and from these boxes, you just have to remember only one box, that is box number 1 for the insurance names. Okay. Now, right portion is for the insured information. That means the policy holder information, nothing but the subscriber information. Here also the ID means whatever policy ID we can see on the ID card. Okay. So sample ID card for any insurance if we are searching. So this kind of ID card is there in our system in that patient. Okay. At this point, we don't have uploaded any ID card, but if ID card is available, then we can open that and it will open like this. And this member ID, policy ID, subscriber ID is same. And right here. Okay. So that will remember. So member ID is equal to policy ID is equal to subscriber ID. Okay. So whatever ID is given here, it is going on the claim form insured ID. Again the 4. Okay. So whatever member ID is mentioned, that member ID is going in under this box. Box number 1A. 4 is for the insured name, policyholder name. Okay. Again, the address in box number 7. Box, it is not mandatory that the address will match. If it is sale, then only address will match. So maybe possible that the policyholder is staying on different address and his parents are staying in different address. 11 is for the insured policy group or FECA number. So some insurance policies are the group plan. So whenever it is group plan, group ID or group number will be there. So if I search UHC ID card, okay. So I can show you here. You can see here. Okay. Here group number is there, right? Some group number is there. So if it is a group policy, then group number will be there. So that group number is going on the claim form under this box. Okay. 11. Insured policy group or FECA number. It is not mandatory actually. Box number 11A is for the insured date of birth and the gender again. Format will be same MMDDYY. Okay. Other claim ID, leave it at this point. The insurance plan name or the program name. As I said, some group plans or the program name or the plan names are for the policy. Okay. You can see here USC Choice Plus. So this is the plan name Choice Plus. Okay. Like this, many insurance companies are having different plan name. You can see here United Healthcare Community Plan. Okay. Like this. So student plan. Okay. You can see a student plan. So like this, whatever plan name is there, it will go or it will enter into the system and it will go in this. Okay. Student plan. Okay. And then the group number, whatever is group number available. It is not mandatory. Box number 11D is there another healthcare insurance benefit plan. That means the patient is having any other insurance or no. Secondary insurance or before this insurance, another insurance, yes or no. We have to write that, check that. It will go, don't worry, we are not doing anything. Again, the digital signature of the subscriber. Okay, digital signature by the subscriber. So from these boxes, these many boxes, just remember box number 1, that is the policy, sorry, insurance names, and box number 1A is for the insured ID, same like policy ID. Okay. Now the say we covered two portion. First is the carrier, second is the patient and insured information. And third portion here is the physician or supplier information. So from this third portion, many boxes are there which we have to remember. Okay. So let's see one by one. Box number 14 is for the date of current illness or injury. So it's not mandatory that whenever patient is coming to our hospital to take the service, that day only he got injured, or maybe from that day only he is not feeling well. It is not mandatory. Okay, just take yourself example for yourself. As if I'm not feeling well today, I'm not directly going to the hospital or specialist. What I'll do normally, first of all, I'll go to my family doctor. I'll take the basic prescription. If it is not serious, then I used to go to my family doctor only, not to the specialist. So I'll take the prescription for 3 4 days. After taking that prescription, also the same condition or maybe the condition is getting bad, then family doctor will suggest to visit the specialist or the hospital. Okay. In US also they are following the same thing. Okay. So maybe possible that 1 week back someone got injured and he has taken a service from his family doctor or maybe another doctor, and after 1 week he came to our hospital to take the service. So that injury date will go here. Sorry guys. So this injury date will go here. So example, today is the date of service. So maybe possible that 1 week back he got injured. Okay. So January 6th, 2026. So here date of injury is going in box number 14. Injury or illness or maybe pregnancy date. Box number 15 is for other date. I never use that. Leave it. Box number 17 is important. This is for the name of referring provider. Now, what is meant by referring provider? Referring provider. So, referring provider means the doctor who referred this patient to visit our hospital or specialist. Okay. So, mostly patient's family doctor called as primary care physician used to refer their patient to visit hospital or specialist. Okay. The referring provider means who has referred that patient to visit our hospital, called as a referring provider. Okay. So here referring provider name is going. Okay. Anything, whatever doctor name is there, Dr. Smith. Yeah. Again, next is box number 17B is for the NPI. Okay. This is the NPI. And NPI. Long form is National Provider Identification Number. Okay. NPI number means National Provider Identification Number. So this each and every provider is getting unique NPI number. So we know that uh, provider is every person or the facility, okay, called as provider, right? So I can write some provider like doctor, nurse, compounder, hospital, ambulance, skilled nursing facility, hospice, physiotherapist, okay, and so on. So every person or the facility which is providing the health services called as provider. So every provider is getting this NPI number. Okay, it's like the identification number. Okay, so here it's a 10-digit number. How many? 10-digit. So every provider is having this 10-digit number. Okay. So this referring provider is having NPI and it is going in the box number 17B. It is not mandatory, but in some insurance plan, it is mandatory to enter the referring provider name and the NPI. Now, next is the box number 18 is for the hospitalization date. Maybe possible that patient for today's date we are billing the claim, but from last 1 week, 2 week patient is in our hospital. So from which date he is in our hospital, that date is going here. Okay, maybe I'll write the today's date. Hospitalization date. Box number 19. So we can see that each and every box is dedicated for some information. We cannot use that box for any other purpose. Right? We cannot use that box for any other purpose. So that's the reason here we have one additional box, that is box number 19. Okay. So if we want to provide any additional information on the claim form and for that information we don't have a dedicated box number, then we can use box number 19. For example, we are attaching a medical record with the claim form. So that's the additional information, right? So we can mention that in our application, we'll have such kind of field where we can add that information, and whenever we are billing the claim, that information is going in this box number. Okay. Attach medical records. Okay. Okay, it is not allowing me. Space is not allowed. Yeah. Okay, so like this additional information, we can send it in box number 19. Okay. Just remember box number 19 is for the additional information. Box number 20 is for the outside lab. So what it means, outside lab means we know that many times our doctor need some blood report, X-ray report, CT scan, MRI, some reports they want to take a decision. Means they want to know more precisely. They don't want to take any risk. Okay. And that's the reason they are asking us to come up with some reports. They will give us a list of report that we have to taken from the lab. So if lab is available, like pathology is available in same hospital or radiology lab is available in the same hospital, then we are not going outside generally. Okay. We are taking from the same hospital. But if that facility is not available in the hospital, then what we are doing? we are going outside lab, outside hospital, in the other lab, and we are spending some money there for that report, right? So if somebody has going outside and taken a service from outside lab and spent some money, then that amount is going here. Okay. And these labs also are sending claim form to insurance if these services are covering under the patient plan. Okay. So it is not mandatory actually. Otherwise, it will go as a no. Now, box number 21, at this point, just remember this box is for diagnosis code. Okay, so box number 20, just we covered outside lab. 21 is for the diagnosis code. It is having total 12 boxes, 21A, 21B, 21C, 21D, up to L. So at this point, just remember this box is for the diagnosis code. So what is meant by diagnosis code, how it look like, what is the purpose and all, everything will be covered in our coding sessions. Okay, we'll have 3 to 4 coding sessions. Okay, and it will help us to understand more about the coding part. Like this, diagnosis codes are going. Diagnose means nothing but every time doctor will check, do the checkup, diagnose the patient and try to understand what exactly happened to the patient. So that part is nothing but the diagnosis. Okay. So these diagnosis codes are there like this. Our coding team is entering the codes on the basis of medical record. Okay. So maximum 12 diagnosis code can bill on the claim form. Okay. Without diagnosis code, we cannot bill our claim. So it is a mandatory. At least one diagnosis code should be there. Now, box number 22. What is meant by box number 22? It is for the resubmission code. So, whenever we are billing our claim form first time to the claim, so first time to the insurance. So, you can see your claim history. This was billed first time. Okay. So, first time if it is billing, then in this box, it is going with 01. That means this is the fresh claim. Okay. This is the fresh claim because we billed first time. So, here resubmission code. Okay. So 01 is for the fresh claim. Okay. That means first time we build claim to insurance. Okay. And another is the 07. That means corrected claim. Okay. Means we did some correction and rebilling. Example, any claim, we receive a denial, some coding related issue or something is there, and accordingly we are doing some changes on the coding part. Okay. I have changed the codes. At this time again I am rebilling the claim. So this time I am rebilling the claim. So while taking the action, I'll select it as a resubmit corrected claim. So if we are selecting this resubmit corrected claim and submitting the claim form, then automatically on the claim form in this box it will go with 07. Okay, 07 is the code for corrected claim. Then only insurance company can understand, okay, some correction is done on the claim form. Okay, otherwise they will not consider it as a corrected claim. So, and original reference number means what? Whatever EOB we received for the first claim, fresh claim, original claim. Okay, the claim number will be there. So that claim number is going here as a original reference number. Okay, if you are doing any correction, then this information is automatically going. But while billing the claim, after doing the correction, then you have to select the appropriate action as I shown you. Okay, resubmit corrected claim. Okay. If we miss to do that activity and we are billing with 01 only, but insurance is already having a 01 claim, so they will deny it as a duplicate. Okay. So major changes are also there, then also they will not consider that claim as a corrected claim. Okay, so it's very important that we should select in the system. Box number 23 is for the prior authorization number. What is mean by prior authorization and all will check in our terminologies. It is nothing but the taking permission from the patient's insurance company. So after taking that permission, this is nothing but the permission number. Okay. So heart surgery will be there after 2 days. So sometimes we have to authorization team is there. So they are reaching to the insurance authorization department. They are confirming is there any need to take the authorization. If yes, then they will fill a particular form and they will submit that, and then we'll get the authorization letter. And on that letter, number is there. That number is going in the box number 23. Okay. So now next is the 24. So this 24 is starting from here, 24A up to 24J. All these boxes are coming under the 24 box. Okay. So 24A is nothing but the date of service, on which date we provided service to the patient. That date is going from and to. Okay, in front of every procedure code. If we provided 2, 3 procedure codes, then on 2, 3 line items, same date is going. Okay. Place of service means box number 24B, B means place of service. This is also coding part. So place of service means nothing but where service has been performed to the patient. So maybe it is a hospital, maybe it is a clinic, maybe it is a ICU, maybe it is a emergency department, maybe it is a home, maybe it is a school. Okay, maybe it is a running ambulance, maybe it is a skilled nursing facility. Like this, so many place of services are there. So we are going to cover that in our coding part. Box number 24C is for the emergency. Okay, I never use that. Can skip that, nobody will ask you. 24D is for the procedure code. So this is the very important box. Okay. That means what service has been provided to the patient. So this is a 5-digit code. Okay, called as procedure code. And related to this procedure code, some diagnosis codes are there. It's a mandatory that for each and every procedure code, related diagnosis code should be there. So actual diagnosis code are entered into the box number 21, and this A, B, C, D up to L are nothing but the pointers. So related to this procedure code, diagnosis code is present at B, then the pointer is going here as a B. If two diagnosis code are there, then B comma A, B comma C, whatever it is related to this diagnosis code. Okay, so in our system, you can see here in coding part, these diagnosis code are there. So in this claim, only one diagnosis code is there, right? If multiple diagnosis codes are there, then here you can see the diagnosis code pointer, right? We can select which one is the primary DX for that, which one is the secondary DX. Okay, it is not mandatory that the sequence will follow. Okay, so here maybe primary DX for this procedure code is present at B. Then one more DX is related to this present procedure code is at C. Okay, so like this is the pointer. And in box number 24D, 4 more boxes are there. It is for the modifier. This is also part of the coding, and it is additional information about the procedure code. It is not mandatory actually. So example, we have X-ray code and we want to give the additional information as this X-ray has been taken for the left hand. So LT modifier will be there for the left side. Okay. RT modifier is for the right side. Okay. 50 modifier is for the bilateral. Like this, so many modifiers are there, and we'll cover that in our coding. So these are the modifier. It's nothing but the additional information about the procedure code. Okay, so next box is the box number 24F, are nothing but the charges. So whatever charges are entered for that procedure code, here you can see 1800, right? So these charges are going in this box. Example, okay. I am taking here $300 for this evaluation management. and 200 for the X-ray. Okay. Days or units. Box number 24G. Days or units means how many units we have provided to the means that procedure code. How many units we have provided. Okay, maybe possible that this X-ray has been taken 2 times before providing service one and after providing service again. Generally, doctor used to take the two X-ray. Before providing the surgery, they used to take one X-ray. After providing the service, again they will take the X-ray and they want to know that whether the surgery is successfully done or not. Right? And this is one unit. Okay. So this is about the units. And 24H, this is reserved for the family plans. Okay. I never use that. 24 J is the again the rendering provider NPI. This is also 10 digit. So rendering provider. Don't worry, this additional notes I'll provide you. Okay. Yeah, whatever additional points we are writing here, you will get it. Okay. So rendering provider means the doctor who actually perform the service. Okay. Perform is render the service called as rendering provider. Okay. Same NPI will go here in front of every procedure. Okay. Yeah. So box number 24J up to 24J we saw. Next is the 25 is the federal tax ID number. So federal tax ID number used for taxation purpose in US. Like we are having PAN card number. They are having tax ID number. Okay. So if under the hospital, doctors are providing service and payment is going to the hospital account, then definitely the hospital tax ID number will here. If you are working for individual doctor, then individual doctor's NPI tax ID number will come. Box number 26 is for the account number. So every application account, okay. Example, this is our practice management software. And we know that for each and every patient, there will be only single account in our application. And if he multiple time he is visiting, that means we are just generating a new visit under the same account. So this visit number is invoice number is different, but the account number is only unique account number, right? This is the account number for this patient. So this account number is going on the claim form in this. Okay, sorry. Okay, so that what is the purpose for sending the account number? So that whenever we are receiving the EOB, on EOB also insurance will mention this account number, and if we are receiving the ERA, electronic remittance advice, then by identifying this account number, automatically that EOB will post to the correct patient account. If it is a paper EOB, then it will help our payment posting team to find out the correct patient account, because maybe possible that we are having 3 4 patients, their names are same, right? So we should post the payment or the EOB in the correct account. So that is only the reason we should send our account number. Automatically it will go, don't worry. Box number 27 is nothing but terms and condition. Always it will go as a yes. Total charges automatically get calculated. I don't know why it is taking. Okay, so let it be, but it will go as a total charges. Okay. Not. If any patient has paid anything, like advance patient has paid, or maybe you are working on secondary claim and primary insurance has paid something, so whatever paid amount will go here. This is reserved for NUCC. So box number 29 is for the amount paid. Box number 31 is again for the what? Signature. Provide the signature actually. This is also digital signature. Okay. And we have two more boxes, 32 and 33. So we should not get confused between these boxes. So 32 is for the service facility location. Okay. So where service has been performed to the patient, called as service facility location. Maybe possible that our hospital is having five branches in the city. So from the five branches, in which branch service was provided, that address will go here. And every hospital is having the NPI. Okay. Hospital is also provided. So 10-digit number will go here. Okay. Actually, 32B is also their license number, but rarely we are using that. So just remember box number 32 is for the service facility address and 32A is for the service facility NPI. Okay. 33 is the billing provider information. So billing provider information, under the billing provider information is five branches are there, but as a hospital, we are using only one branch as a billing address. So that will receive all the EOBs, all the letters, all the checks, everything will receive on the billing address. So that address will go here. Maybe possible that the hospital don't have any other address. Okay. Only one branch and only one address. So in both the boxes, same address will go. So client to client, may be possible if they are having different address, then it will go different address for the billing purpose. Okay. Again, NPI will be here. So these are the 33 boxes, and from these 33 boxes, if you go through the notes again, okay. So I have mentioned the important boxes. Let me revise in 5 minutes. So one is for the insurance names. One is for the insured ID, subscriber ID, policy ID. 17 is for the referring provider name. 17B is for the referring provider NPI. It will be a 10-digit number, national provider identification number. 19 is for the additional information. 21 is for the diagnosis codes. It is having 12 boxes. 22 is for having the resubmission code. Always 01 will go for the fresh claim. 07 will go for the corrected claim. 22A is for the original claim number, right? So whenever we are sending a corrected claim, that time original claim number will go. Otherwise, it will go as a blank for fresh claim. It is nothing but the claim number, whatever we receive on the denied EOB. 23 is for the authorization number. 24J is for the rendering provider NPI. Okay. 20. You can remember 24D as well because the procedure code is going. 25 is for the tax ID number, 9-digit number. And 32 and 33 is service facility address and the billing facility address. These are some important boxes, and randomly interviewer can ask you some boxes, like 2, 3 boxes, they can ask you randomly. And this is the easiest question, so we should not miss it. Why we spend this much time to understand the claim form? Because all over years, same claim form will be there. Whatever applications you are going to use, claim form will open as it is. Okay. There will be no changes, right? And if you are new to the application, then it is a best practice. Just open the claim form and while calling to the insurance and all the required information, whatever they will ask you, might be possible. They will ask you the policy ID, they will ask you the date of service, they will ask you the provider NPI, they will ask you the tax ID number. Okay, so everything is available on the single page. There is no need to go here and there in the application in initial days, right? So best practice. So this is about the CMS 1500 form. It is used for the uh, patient billing, and one more name is there for the CMS. So first of all, you have to remember the long form, Center for Medicare and Medicaid Services. Right? And also it is called as HICFA. Long form is Healthcare Finance Administration. So if someone is asking you in the interview, tell me what is the purpose of HICFA form? Have you heard about the HICFA form? HICFA is nothing but the CMS 1500. Only the name is different. So for today, I'm stopping our session 3.